Dr. Nardi here, back with another video. And in this video, I want to discuss major depressive disorder. And I want to approach it from a couple different perspectives. One, I'm going to talk about the overview of the disorder. And then I'm also going to talk about how we treat it, at least from a psychopharmacology perspective, and what are the underlying biological mechanisms of major depressive disorder. So let's get started. So major depressive disorder can be endogenous, meaning it's internal to the individual, or it could be clinical, meaning it's more caused by the external environment. Now, we know that major depressive disorder has a huge genetic component. The way we know this is we look at monozygotic twins, and they have about a 65% concordance rate, as opposed to dizygotic twins, which is about 14%. And for those who are kind of following along, when we talk about monozygotic twins, we're talking about like identical twins. And we're talking about dizygotic twins, we're talking about fraternal twins. Now, the National Institute of Mental Health, they kind of define major depression as how it impacts someone feels, how they think, how they sleep, how they eat, and it impacts their work. And this has to go on for about 2 weeks. And, regardless of getting to the very specifics of the definition, looking through the DSM, which is another tool we use as psychologists, the Diagnostical and Statistical Manual, we'll talk about some commonalities. So symptoms common to all depressions, not just major depressive disorder, but all depressions, are sadness, despair, emptiness, apathy, low self-esteem, negative pessimistic thinking. There could be suicidal thought, or what we call suicidal ideation. There could be a lot of indecisiveness, and there could be excessive guilt. Now, there are a couple theories to why major depression disorder occurs. And one of those is what we call the bioamine hypothesis of mood. And this is really a medical model, and it looks at what we call monoamines. And we look at these monoamines, by the way, which is norepinephrine, which is neurotransmitter. We can look at dopamine, which is another neurotransmitter. And we can look at serotonin, which is another neurotransmitter. And we look at this imbalance of these neurotransmitters, and this imbalance influences our mood, right? So depending on how much of these, the balance of these three neurotransmitters, this kind of determines our mood, and this might cause major depressive disorder. And this is actually how some of the medications work, is by balancing out these monoamines. Whenever you're looking at major depressive disorder, you want to rule out any kind of underlying medical disorder. That would be the clinical part that causes depression. So you want to rule out brain tumors, asthma, cancer, some kind of cardiovascular condition, diabetes, Cushing's disease, congestive heart failure, hepatitis. Any one of these you'd want to rule out to make sure. And you want to make sure that there's no underlying biological causes. The other thing that you want to rule out is any kind of substance use. So if someone's taking a substance, this could be an illegal substance, an illicit substance, or it could be a legal substance like over the counter that you prescribe from your doctor, but then now you're not taking these substances according to your doctor's prescriptions. It could be alcohol, could cause major depressive disorder. Sometimes anxiety medications like diazepam, clozapam, any of these could cause major depressive disorder. Maybe an antihypertensive medication could cause anxiety disorder. Any anti-inflammatory medications can do this as well. Anybody who is taking anti-Parkinson's medications, that could cause major depressive disorder. Even over-the-counter cold remedies could cause major depressive disorder. Corticosteroids have been known to do that. And then drugs of abuse. So this would be marijuana, codeine, morphine, PCP, crystal meth, psychedelics, opium, right? Synthetic painkillers, any kind of drug of abuse could cause major depressive disorder. And any kind of sedative or hypnotic medications could also cause it. So you want to be very careful if you're on medication, and your doctor would screen you for this, your psychiatrist or your psychologist that you're seeing, to make sure that, again, that there's not an underlying biological cause or not an underlying drug use cause. Now, when we want to think about treating major depressive disorder, we could think about using antidepressants. And there are different categories of antidepressants. There's monoamine antidepressants. There's tricyclic antidepressants. There's also atypical antidepressants. And there's also selective serotonin reuptake inhibitors. And we'll talk more about all these medications in just a few minutes here. But I will tell you this, SSRIs, or selective serotonin reuptake inhibitors, are the primary drug of choice for treating depression, followed by what we call SNRIs, which are a little different. They are serotonin norepinephrine reuptake inhibitors, so they're a little bit newer on the market, followed by tricyclics and MAOIs, which, by the way, are used less frequently because of their side effects that they potentially can have, especially with certain foods. But we'll talk about that in just one moment. So let's talk about some basics of your biology. In particular, we'll talk about some basics of neurotransmitters. So the precursor to monoamines is a tyrosine. And that is actually, more specifically, tyrosine is a precursor substance to dopamine. And tyrosine is broken down into L-dopa and dopamine. And once that happens, dopamine is then stored and packed into vesicles. And then dopamine is released into the synapses. And then neurotransmitters, when they're released from the synapse, they go to the postsynaptic neuron, and they bind to specific receptor sites on that postsynaptic neuron. And once those neurotransmitters are bound, right, some of those neurotransmitters bind, and then some degrade within the synapse, and then some of them are broken down by monoamine oxidase. So we got to keep that chain of events in mind. And there's actually a reuptake pump embedded in the presynaptic neuron where access to neurotransmitters are reabsorbed. So some of the neurotransmitters get reabsorbed and metabolized back into the cell to be reused. Now, here's the thing with tyrosine. Tyrosine is an amino acid that comes from food. So production of these endogenous monoamines includes avocados, bananas, peanuts, turkey, chicken, edamame, spinach, salmon, and cottage cheese. So again, this tyrosine comes from and the production of monoamines comes from these foods that I just mentioned. And then the other thing we have to think about is tryptophan, which is also amino acid derived from food, and that's actually a precursor to serotonin. And some of the theories behind major depressive disorder is they say that chronic stressful situations, such as environmental stress or some kind of chronic trauma, may develop and cause a dysregulation in the functioning in the neurotransmitter, and more specifically in the sympathetic nervous system. And as a result of chronic trauma, individuals become more susceptible to depression, anxiety, and other mental disorders. Now, I want to briefly mention tricyclic antidepressants, also known as TCAs. Now, TCAs block norepinephrine, serotonin, and to a lesser degree, they block the reuptake of dopamine on the presynaptic neuron. By doing this, it increases the level of neurotransmitters in the brain. So when we increase neurotransmitters in the brain, we actually reduce depression. Now, TCAs are absorbed in the gastrointestinal system, and they undergo first-pass metabolism. So all TCAs have efficacy and are prescribed to patients based on their side effects, what side effects it could cause, and the duration, how long the drug will stay in your system and act for. A side effect, though, of TCAs is they block alpha adrenergic, histamine, and muscarinic receptors, which cause side effects. Some common side effects are sedation, hypotension, cardiovascular effects, seizures, and a weight gain. Serotonin, norepinephrine reuptake inhibitors, or SNRIs. These antidepressants are similar to TCAs and inhibit the reuptake of norepinephrine and serotonin. Now, the good thing about these is they have fewer side effects. However, both of these drug classes block more than one reuptake pump. And if we're talking about SNRIs, antidepressants, they include second-generation antidepressants, but there's also newer third-generation antidepressants. We call these atypical antidepressants. And some of these you might have heard of, like trazodone is a third-generation antidepressants. And these are used, again, to treat major depression and depressive disorders. We also have selective serotonin reuptake inhibitors. Now, as I mentioned earlier, SSRIs are your first choice in treating depression and anxiety. Fluoxetine, also known as Prozac, you probably know the Prozac name, is an SSRI. It's a very common SSRI to use. Now, all SSRIs require haptic metabolism and have a half-life of 18 to 24 hours. Now, when I say haptic metabolism, I'm really talking about how the drug is broken down in the liver. Now, all SSRIs act on blocking the reuptake of serotonin back into the neuron. And by blocking the reuptake of serotonin back into the neuron, you're now increasing the level of serotonin, which has been associated with mood. And this is why we think that SSRIs are very effective in treating depressive disorders. Now, monoamine oxidase inhibitors are structurally actually similar to amphetamines and can be orally activated, meaning given orally. Now, here's the issue with these, with MAOIs, is that foods rich in tyramine should be avoided while taking MAOIs. And I'll give you a list here in just a minute. And before I give you the list of foods, why do we want to avoid these foods? Now, if you think back to when I was talking about monoamine oxidase inhibitors, it's because the enzyme monoamine oxidase is needed to break down these foods. But with an MAOI agent, or drug as we call it, tyramine cannot be metabolized, which causes a toxic buildup. So what MAOIs do is they block monoamine oxidase. So they inhibit it from breaking tyramine down. Some of those foods are avocados, bananas, beef or chicken liver, brewer's yeast, broad beans, caffeine, cheese, meat extracts, overripe fruit, papaya, pickled herring, raisins, red wine, beer, and sherry, sausage, bologna, pepperoni and salami, sour cream, soy sauce, and yogurt. Now, if we're talking about the pharmacological effects and the clinical uses, all antidepressants have a number of pharmacological effects. One of the most common side effects is sedation, so feeling sleepy. Now, the TCAs, tricyclic antidepressants, have more side effects than the other classes of antidepressants I mentioned. However, TCAs continue to be the most useful for patients with psychomotor retardation, sleep disturbances, poor appetite, and weight loss. TCAs are also used to treat bipolar disorder. As an adjunct agent with a mood stabilizer, they can also be used to treat affect disorder, acute panic attacks, phobia disorders, and attention deficit disorder, just to name a few. MAOIs are thought to be most useful in patients with significant anxiety or they have phobic features. So SSRIs may decrease appetite or cause some weight gain. Loss of weight can be seen with these drugs, at least for the first 6 to 12 months of treatment. And here's the thing with these drugs, SSRIs may increase suicidal risk in children and adolescents. So keeping that in mind, if you're prescribing these medications, or you know somebody's getting prescribed these medications, you have to be very careful with this because of the increased risk of suicidal ideation, and also affects users between 18 and 24 years old. SSRIs are approved for use in patients who suffer from general anxiety disorder, panic attack, social phobias, bulimia, and you can also use it to treat alcohol dependence. You could also actually use it to treat obsessive compulsive disorder. Well, that's it for this video. As always, thanks for watching. If you like this video, give it a thumbs up, leave a comment below, and I will see you all next time. Take care. Bye-bye.